We've gone from an acute relative stay index in the mid-90s to 75%. And the key drivers in that process were, well, from 2012 onwards, we've had a really big focus on reducing our average length of stay right across the board. We've also had really good engagement with the multidisciplinary team in proactively identifying patients that could be long stay stranded patients, identifying their issues much earlier and reducing their length of stay. And then once we did that, we were able to start using our ED short stay ward the way it was meant to be used, rather than as a holding bay for patients awaiting an inpatient bed. In 2015, we introduced a fully funded MAPU, and we've also seen a really good improvement in our top DRGs across the board over time, but particularly in the areas of cardiology and respiratory. Well, our problem in cardiology was that in 2011-2012, our average length of stay was the worst in the Health Roundtable peer group.
Wow.
So our solution was, well, our cardiology director's solution was to sit down and have a look at the service as a whole and identify what was the best setting for each patient to be getting care in. What could be done in the GP setting, what could be done in the emergency department, outpatients and in the inpatient setting. So once he looked at the service as a whole, he made the necessary changes, and then within 2 years, we saw the cardiology average length of stay drop by 40%. It had come down by 1.2 days per patient. And in doing that, we achieved a $3.2 million saving in the bed days, and that basically equated to 6 cardiology beds freed up each day on paper. We've had a very similar improvement in respiratory too. Thanks to the effort and the dedication of our multidisciplinary respiratory team, we've seen their average length of stay drop down to 3.8 days, and that's almost half of where it was sitting 5 years ago.
Wow.
In elective surgery, a lot of people ask, how does Logan Hospital maintain zero long waits? What's the magic bullet? There is no simple solution. We know that the reality is that it comes down to the team. Each individual deciding that they want to help to meet that end goal. So everyone, every day, works on their own contribution, whether it be the bookings, the theatre scheduling, the equipment, or actually treating the patients. Each one of those tasks done in the right way at the right time, that's what makes our zero long waits a reality. So overall, there's a common theme in our success stories, and that's the team approach. And we've seen that when we can get the team thing right, we can succeed in tackling some of those bigger, complex issues that have popped up in our Health Roundtable reports over and over through the years. So for us, it's the people that make all the difference.